My name is Rebecca Davis, the Medicare Wonder Woman, because I take the wonder out of Medicare. And today I'm going to be talking about the 2020 premiums and deductibles of original Medicare. So when you guys are brand new to Medicare, you're going to get a Medicare card, original Medicare card, and it's going to look just like this. It's going to have your name, it's going to have a number that kind of looks like a VIN number like on your car, and then it's going to have two dates where your effective dates of Part A and Part B. That's when your original Medicare actually becomes effective. So those dates are very important. But what a lot of people don't realize that even though Medicare is given to you, there is a lot of holes with Medicare, and we're going to be explaining how the card works for you. So with Part A, it's your hospitalization. With hospitalization, you get hospitalization, your skilled nursing, your first 3 pints of blood, and that has a cost. There is a deductible, believe it or not, when you go in the hospital of $1,484. Now, the thing about that deductible, it's not a one and done deductible like traditional health insurance. That's per benefit period. So depending on how you go in and out of the hospital, you can actually get hit with that multiple times a year. So be very aware of that when you're on original Medicare. Just because you went in the hospital in January and paid out $1,484, if you go back into the hospital again in July, you're going to owe that number again because it's not a one and done deductible. The other thing to be aware of when you're in the hospital is when you're in an extended stay situation where you're there for several days on end. When you hit the day 60 mark, you're going to start to incur a copay at day 60, and that copay is going to be $371 a day. Yes, you heard me right. $371 a day every day you're in the hospital starting at day 60. And that continues till you hit day 90. And then at day 91, it goes up again. At day 91, it goes up to $742 a day until you've hit your maximum lifetime day. So at that point, you're going to be paying $742 a day if you're still in that hospital. So this can actually get very expensive, even though Part A is what you've worked for your entire life and have paid into the system for. It doesn't cover your hospital stay at 100%, so it's good to know these numbers. The other thing on original Medicare is Medical Part B. Medical Part B is what we all have to pay for. The standard current rate of Medical Part B is $148.50. So everybody pays at least $148.50 unless they're by chance have Medicaid as well, then the state will pick it up. But any traditional working citizen that's had, middle income class citizen, they're going to be paying $148.50. Now, if you made quite a bit of money in your career, you could pay more than that. So that's not that's the baseline, but it can be higher than that. So let's say you made $200,000 a year, you're going to be paying more than this. And the government, Social Security, will send you a letter and let you know what that will be. So it won't be a surprise, they will let you know. But just be if you were a higher money earning person through your career, you're going to be paying more for Part B than maybe your neighbor would be. But the $148.50 is the standard price for Part B in 2021. Now, with Medicare Medical Part B, that covers your doctor visits, your home health care, your ambulance services, your surgery benefits, and things like that. And there is a small one-time deductible of $203. So that is at a traditional deductible. It's one time a year. It's $203 for 2021. Once you've met the $203 deductible, then you're going to go into a 20% coinsurance. So what that means is after you've paid $203, every bill after that, you're going to pay 20%. It doesn't matter if it's $100 or $1 million, you're responsible for that 20%. So if it's $100, you're going to be responsible 20%, it's $20. If it's $1,000, it's going to be $200 and so forth. And the scariest thing to me about that is the 20%, there is no cap. So they can just keep billing and billing and billing with traditional Medicare. There is no cap. There is no end to the bleeding, so to speak. So if you're in, if you have some health issues, you're going to be paying a lot as you go on traditional Medicare. And that's why there's things like other plans out there, like whether it's Medicare Supplement, known as Medigap plans, or Medicare Advantage style plans, that help pick up these costs. The other thing you need to know about original Medicare, there is no prescription drug coverage. So it does not cover your prescriptions. So whether you choose to do a Medicare Advantage plan or a standalone Part D plan for just prescription medication, you're going to want to pick that up because there is no drug coverage on traditional Medicare. The other things there's no coverage for on traditional Medicare is dental. So no dental coverage, not even a basic cleaning, you guys. So dental, if that's important to you, you're going to need to find another plan for that. There's also no vision coverage. Now this can be a little tricky because you say, well, Rebecca, I have cataracts. Will that be covered? Yes, cataracts will be covered under the traditional Medicare because it is a medical service. It's a surgery, so that will be covered. But your typical doctor's appointments or vision appointments when you just get your eyes checked and refracted, that's not covered. Or if you need a pair of glasses or contact lenses, those costs will not be covered. Other things that are not covered are hearing aids, transportation, food benefits, and the list is kind of endless. Medicare covers medical. So if it's medically related and necessary and Medicare approved, your traditional Medicare card will cover it. But if it's prescription drugs, if it's dental, vision, and hearing, if it's transportation, if it's over-the-counter benefits or meal benefits, traditional Medicare will not cover those things. And that's where, again, those other plans like Medigap and Medicare Advantage plans and Part D prescription drug plans come into play. So it's very important to know what your Medicare card actually does so you can make the proper decisions to protect you if you need additional benefits. Again, Rebecca Davis, the Medicare Wonder Woman. I hope this helps.